My name is Gajjar, and I'm a medical student at Albany Medical College and a research fellow in the Department of Neurological Surgery at University of Pittsburgh School of Medicine. On behalf of my team, I'd like to thank the neurosurgery staff for highlighting our study titled Usefulness and Accuracy of Artificial Intelligence Chatbot Responses to Patient Questions for Neurosurgical Procedures in the journal Neurosurgery. AI is used in medicine to aid in clinical decision-making for tumor segmentation, stroke, screw navigation, and more. ChatGPT is a large language model with extensive training and has the ability to interact with users in the chatbot format. To date, it has passed USMLE Step 1, 2, and 3, as well as neurosurgical written boards. This study was done in the context of online health information seeking, as nearly 90% of Americans search symptoms online prior to consulting with their physician. However, the quality of the health information varies and can be misleading, and is far too complicated for the average American who reads at a 7th grade level to understand. Therefore, this study aims to evaluate the accuracy and usefulness of ChatGPT-generated responses to common post-operative questions in neurosurgery. To do so, we generated 60 commonly asked questions by patients postoperatively split into spinal, cranial, and general neurosurgery. These covered a broad range of topics such as pain management, activity restrictions, wound care, and more, all of which can be seen below. We then distributed a survey to fellowship-trained neurosurgeons and dedicated neurosurgery nurses to evaluate the accuracy and helpfulness, and used a standardized understandability and actionability assessment known as the Patient Educational Material Assessment Tool as well. Finally, we conducted a readability assessment using numerous grading scales that have been validated, such as the Flesch Reading Ease, Flesch Kinnaid Grade Level, SMOG, Coleman, Liao, Gunning, Fogg, and more, to evaluate how understandable it is. The results show that ChatGPT's responses are notably accurate, with a mean accuracy score of 4.22. Additionally, however, they were deemed less helpful with a mean rating of 3.6 out of 5. Nurses generally rated the AI responses as more helpful and accurate compared to attending neurosurgeons, showing that while ChatGPT's responses are accurate, there is variability in perceived helpfulness, particularly between nurses and surgeons. The readability assessment showed that the text produced by ChatGPT is read at a difficult, if not graduate level. The context shows that compared to the recommended level of 4th to 8th grade by the Agency of Healthcare Research and Quality, this is far above the recommended guidelines. AI does excel in providing actionable guidance, although it's far too complicated to understand for most patients, and improvements are needed for clearer communication. In conclusion, AI chatbots provide accurate information, but are not perceived as beneficial. AI-generated information can assist, but cannot replace direct communication with a neurosurgeon. The full article can be seen below. Additionally, I'd like to thank my team for their help, whose Twitter handles can be seen here. Please take a look to learn more about our research efforts, and thank you for your time and interest into this study.